He was ventilated for more than a month and required total parenteral nutrition for about 5 weeks and was discharged on day 68. This is him in the immediate post-op period. This is him at discharge with his father, the donor. This is him 4 years later. This is him 7 years later. This is him 10 years later. He now is 13 years old and studies in Kanchipuram. And the parents were really excited when they wrote to us last year that he stood first in his class. And he is the longest survivor of a liver transplant in India and is doing absolutely well. And he's really the brand ambassador of liver transplantation in India. You can see here that here is a baby who is very deeply jaundiced. This is Suvajit Pal, 5.5 months old when he was diagnosed with biliary atresia, underwent a Kasai's procedure, but because the surgery was done very late, it didn't work, and he was referred to us with progressive jaundice, abdominal distension, and in fact, just before his transfer from Calcutta, he'd actually had a convulsion. He had very high bilirubin, 48.3, low albumin, deranged clotting. We transplanted him in August 2008. We had a problem with portal vein flow. DrSubhash reoperated on the 14th, did a cavo-portal transposition, and the child was discharged 3 weeks later. And this is him as the youngest child to have received a successful liver transplant at discharge. This is him a year later. You can notice how bright his eyes are, although he's wearing yellow and the background is yellow, but the eyes are absolutely white here. This is a 4-year-old boy who was referred to us from Meerut. He'd actually gone into hepatic coma. There was no identified etiology. We transplanted him in November 2007. The donor was the mother. He was discharged 24 days. He remains well 2.5 years post-transplant. And this is a child from Doha, and you notice again that she has very yellow eyes and she's under a phototherapy unit. She was born in Qatar and was found to have progressively increasing jaundice, which was unconjugated. She required intensive phototherapy and she had Crigler-Najjar syndrome type 1. She was referred to us at 2 years of age for a liver transplant because it was becoming very difficult to maintain her bilirubin level because now she was free to move around and it was very difficult to keep her under phototherapy units for like 12 to 18 hours a day. She had normal liver function but high bilirubin. All of it was largely unconjugated. We transplanted her September 08 and she was discharged after 20 days. And you notice here again, those yellow eyes are now really white. This is a little fellow from Noida. His earlier sibling had died because of undiagnosed liver disease at 6 months in another hospital. He developed jaundice immediately after birth. We transplanted him at about 7 months. This is him celebrating his birthday after the transplant. And this is a child with Wilson's disease. Again, you notice he's jaundiced, he's malnourished, he's 15 years old. And this was really a special case because this patient had written from Lahore to Mrs. Sonia Gandhi, and she actually sponsored this liver transplant, and he's an avid cricket fan, so she invited him and the team home and presented him with a cricket set, and he's been back for his follow-up, and he really enjoys playing cricket now in Lahore. This is a child referred to us from PGI Chandigarh with Budd-Chiari syndrome, doing really well post-liver transplant. And here's a child from the West Bank in Palestine, and this is after removing about 3 liters of fluid. He had Budd-Chiari syndrome, and his mother was the donor. He underwent a successful liver transplant, and when it was time for him to go, we really had a very interesting situation where the Israeli ambassador called to congratulate the family, and the Palestinian High Commissioner came with cake. So we actually got some diplomatic realignment happening when this transplant was done. This is a child we had to retransplant because he developed portal vein thrombosis and he remains well 5 years post that surgery. And here's a child again from Chandigarh with fulminant hepatic failure who came to us with coma and has done really well post-transplant. And this was another child who came to us from Pakistan, and he again, everybody is very fond of cricket in Pakistan. He had that one desire that I want to meet Sachin Tendulkar, and as it so happened that the Indian cricket team was playing at Firozshah Kotla, so we actually took him to meet Tendulkar, and he played cricket with Tendulkar for about half an hour in his suite, and then underwent a successful transplant, and then he was ready to go. He wrote this out, Sachin, see you in Lahore, and Subhash saw the family a few weeks ago, and this child is doing really well. He had biliary atresia. And these are 3 children we transplanted within the course of a week. a child from Nepal, Anil, with Wilson's disease, Kalol from West Bengal with VSD, biliary atresia, and a child with cryptogenic cirrhosis from Haryana. And this was our first Bangladeshi patient. You again notice that she's got yellow eyes. She had a Kasai's portoenterostomy in Singapore, which hadn't worked. She underwent a successful liver transplant, and this is her first meal that she's enjoying after a successful transplant. And these are two brothers with progressive familial intrahepatic cholestasis from Peshawar. This one we've transplanted, and he's doing really well. And this is another little one from Calcutta, and had a Kasai's portoenterostomy which didn't work for biliary atresia. This is her immediately after transplant, and this is her a few months later, and of course she's now got teeth and she's looking absolutely wonderful. And here's a child from Assam who underwent an unsuccessful Kasai. We transplanted about 3 weeks ago. This child, again, a very precious baby. The mother was unable to conceive and found to have neonatal hepatitis at birth. The family was very committed, but they had no money. And again, a wonderful story that how India has changed over the last decade. 10 years ago, nobody was willing to donate anything for anybody. And here, Navjot Singh Sidhu came and donated money for this transplant. And this is this child a year later, courtesy Mr. Sidhu. And this is a child from Kanpur with biliary atresia who underwent a liver transplant but then developed portal vein problem. He developed portal vein stenosis, and we put in a stent in the portal vein, and he's doing really well. So we've performed 41 pediatric liver transplants, and in this much time we've done nearly 280 adult liver transplants. The commonest indication has been biliary atresia, then progressive familial intrahepatic cholestasis, cryptogenic cirrhosis, fulminant hepatic failure, neonatal hepatitis, Wilson's, Budd-Chiari syndrome, tyrosinemia, portal vein thrombosis, hepatocellular carcinoma, Crigler-Najjar syndrome, and congenital hepatic fibrosis. We've performed 7 transplants in babies less than 7.5 kilos, and as you notice here, we have 100% patient and graft survival in this group. Our longest survivor is 11 years post-transplantation with normal liver function, leading a normal life, and our patient survival rates after 2007 are 90%, and we've actually done 227 pediatric and adult liver transplants in the last 2.5 years. For us, 2007 was the watershed, and till then, just about 15% of those who were fit underwent a liver transplant, but after that, about half of those who are fit for a liver transplant are actually undergoing a liver transplant. What has contributed to success? Well, better planning, early referrals when the patients are not that critically ill, better tools that we have, and you can see here a very nice CT angio, so there is no need to do an angiogram, and Subhash can really plan out the surgery well in advance. He can look at all the hepatic vasculature and see what he needs to do when he's planning the donor operation. He can look at the portal vein and again plan very well. He can get an MRCP done and look at whether there are any anomalies with the biliary tree that he needs to address. And with the evolvement in surgical expertise and the techniques, we now are in a position to do left lobe transplants. We can do left lateral segment or right lobes, or we can do a whole graft if we get a pediatric donor. What has contributed to this success in India? Well, better intra and post-operative monitoring, I have to say. Intensive care has got better. Our patients are extubated the same day. They don't remain in the ICU very long now. Post-transplant care is very standardized. There are fewer complications. We have better immunosuppression. And by and large, I have to say that there is now greater awareness. About 11 years ago, when we talked about liver transplantation, everybody was skeptical. Now, that is not the case, whether it's the medical community or whether it's the public. And because our outcomes have improved, we are now comfortable in expanding the indications, and maybe 3 years ago, we would not have done a liver transplant on a child with Crigler-Najjar syndrome, but we're happy to do that. We're happy to transplant smaller and smaller babies. There is, by and large, a greater acceptance of liver transplantation, and we are now able to guarantee the cost. And the package for our pediatric liver transplant is from 12 to 15 lakhs, and we know that the average length of stay is 17 days, so we can very much guarantee this package.